it's interesting to try to plan a talk into a conference that could take 1,000 forms, and it turned out to have taken the form it did. So I found this conference fascinating myself, and we'll decide how much what I'm about to say ties in strongly to the themes of the conference or only tangentially. I want to talk about something we haven't talked about too much, and that's the potential role of schools in preventing violence. And I think schools, those of you who are American remember the bank robber Willie Sutton, and Willie Sutton was asked why did he rob banks, and the answer was because that's where the money is. And why do some of us work in schools? Because they are a population-based vehicle for reaching children. And so what I want to talk about is some work that we're doing on generating evidence of school-based strategies to promote children's development in conflict-affected countries. Carly Tubbs, a PhD candidate currently at NYU, is a co-author of this, but Catalina Torrente, who's sitting right there, put your hand up, dear Catalina, was the project director of the work in the Congo and a co-conspirator in a huge amount of this work. So I'm going to briefly talk about 5 things: the state of armed conflict around the world, because I'm especially interested in education in areas of conflict, and move on to talk briefly about what we know about how armed conflict affects children, and adopt an evidence-based, process-oriented socio-ecological model. For those of you who know works of Mark Cummings or Ann Maston or folks like that, very related to that. What role might schools play in breaking the transmission of patterns of conflict and violence in countries, especially in low-income and conflict-affected countries, with special emphasis on the kind of social-emotional learning interventions that Nancy talked about some this morning. And then briefly, we're starting a new center at NYU called Global Ties for Kids, and I'm going to use a few examples from the Democratic Republic of the Congo and Lebanon as examples of the kind of work that I think we need to do that way too little is done by, and finish with a few thoughts about research and practice agenda, all in less than 30 minutes. So, 25. Well, I said 25 is less than 30, but thank you. All in less than 25, now 24, now 23 minutes. So, peace and conflict around the world, there's 1,000 ways of thinking about this. And some of you might have gone to the session yesterday on organized crime and organized violence. And there the sociologist, criminologist Suzanne Karstedt talked about a violent societies index that she had developed. And there are several such indexes around. The Global Peace Index is an especially interesting one. It has 22 indicators, and it conceptualizes peace at a country level, not at a local level. And these 22 indicators are in 3 domains primarily: level of safety and security, which in a way is the opposite of violence. I mean, we've talked about violence, but the positive valence on that dimension is safety and security. The extent of internal and external conflict and the degree of militarization in a society. So I think it's important to be able to empirically characterize the levels of conflicts in societies and communities. This particular indicator is heavily weighted toward the 3 bullets there: the level of internal armed conflict, the number of potential of deaths from internal and armed conflicts, and the number of internal and external armed events. This is the way the world looked in 2008 based on that index. Red is the least peaceful places in the world, so parts of Central Africa, parts of the Middle East, and the most peaceful places in the world are north and east of me, Canada and Scandinavia, and or way on the other side of the world, Australia. And this is the way the world looked 6 years later in 2014. And you see a lot of growth, adding of Syria, adding of the Ukraine and parts of Russia, China, They all went in ways. On this particular index, 111 countries deteriorated in peace in the last 6 years, and 18 of the 22 indicators worsened. Now, these may be the jagged little upticks that we see in those downward trends. So there's periods of sustained downward trends. These data about recent increase in conflict does not contradict the notion of long-term trends, but something is happening that's amiss, and we're living. We had almost nothing to do with the trends that started in the 15th and 16th century, and we will have absolutely nothing to do with the trends in 4 centuries from now. The deterioration is mostly around terrorist activity, internal and external conflicts, and then displaced peoples. There's been a huge uptick in displaced peoples just in the last 6 years. So what could a relatively micro-level, child-centered approach bring to this? And boy, I wish we had another entire day to talk about integrating micro and macro, which is, I think, the biggest theme and biggest issue that came out of this conference for me. And I have some ideas even about what might be productive ways of doing that. But we're defining armed conflict the way Mark Cummings does as acts of violence which are collective in nature and organized around things like group identities or political motivations. And while the overall level of armed conflict has gone down since World War II, the nature of conflict has changed. And many people know this, and it's been widely noted, from external interstate wars to intrastate wars. And a lot of these things leave children more vulnerable. There's growing evidence that armed conflict, I'm not particularly comfortable with the distinction between intimate violence and state violence. I forget what the distinction was the very first morning of our meeting. I think these forms of violence are interrelated, and I think there's growing evidence that state-level, community-level violence potentiates other forms of violence at more micro level. And that would be a reason to be concerned about these things in these countries. By the Peace Index standards, about 1 billion children under 18 live in countries or territories currently or recently affected by conflict. So it's a big number. It's a big number of people that we're talking about. So, and it's a little bit like smoking. If intimate partner and child family violence is the most impactful, even if there's a smaller effect size on something like GDP, for those of you who've read a recent report, it's a little bit like smoking. Cancer has a very small effect size. Smoking has a very small effect size on cancer, but you multiply it by the populations, and it has a huge societal impact. And that's kind of the way I'm thinking about this kind of work. So, a child-centered approach. We're knowing more and more about how armed conflict affects kids, evidence from different forms of developmental science. The dominant one that Nancy and Teresa talked about is this dynamic, probabilistic, transactional, ecological systems perspective on human development. And since World War II, there's been a lot of attention to the effects of war on kids with increasingly rigorous methodologies. The consequences of armed conflict, we now know, vary tremendously. There is not a simple average effect with a short variance, a little variance around it. There's a wide variation, and the moderators of that make a lot of difference. So one clear thing is development of mental health systems increases under conditions of armed conflict, but they range from prevalence rates of 10 to 90% in the published literature. The frequency and severity of exposure to violent events are related to diagnosable problems like depression, anxiety, PTSD, but they do go up with other stressors, or what Nancy called multiple risk factors, cumulative risk factors. We talked less about the effects of exposure to armed conflict and poverty on children's academic performance. There's the largest number of children out of school who we aren't reaching Millennium Development Goal 2 around are kids in conflict-affected countries. And even those kids in conflict-affected countries who are in school aren't learning nearly as much as they could. These are baseline data from the Congo, where second, third, and fourth graders, 85% of the children could not respond correctly to one reading comprehension question after 2 to 4 years of schooling in the eastern Congo. And these are hot off the press data of Syrian refugee children in North Lebanon and the Bekaa Valley, and using the ACER. The first one was using the AGRA and EGMA, RTI's, USAID's favorite reading assessment, and this is using the other team's favorite reading assessment, the ACER. And again, very, very low levels of nothing, word, letter level, word level, paragraph level. By the time kids are 10, half the kids can't have nothing, and a small fraction of the kids are at paragraph level of reading under these circumstances. So there are both mental health and academic outcomes related to all this. There's growing evidence, it's non-experimental, but there's growing evidence that the level of exposure to sectarian fighting increases adolescents' own aggression. There's big reasons to be concerned about that, as you heard from several people in this conference. And this is from work by one of Mark Cummey's colleagues, Laura Taylor, that describes that. But all of those are average or main effects, and we know that many things moderate the influence of exposure to armed conflict on children's development. We've talked almost nothing about genetic variation, and so some of you know about the genetic polymorphisms that are now thought as conferring differential susceptibility to the environment. And when the environment is good, it multiplies the effects of good environments on kids. When the environment is bad, it multiplies the negative effects on kids. And so one big source of variability in treatment impact is probably genetic variability in responsiveness to the environment, and things like temperament. So this is the environment, this is temperament. In families, peer groups, schools, and other community institutions all are moderators. Some of them are hypothesized, some of them are found. A process-oriented social ecological model looks like this. And don't worry, I'm not going to walk you through it all. But we have to think about the processes, the macro, historical, and community and individual level processes by which communities and people get, quote, selected into areas of armed conflict. We don't randomly assign communities or families to armed conflict. There are selection factors, and we need to think about them. We need to clearly distinguish armed conflict from non-sectarian forms of violence, in Mark Cummings' opinion, and I agree, they are not identical. And then you've heard a lot about contextual, interpersonal, and intrapersonal mediators. What are the mediators? What are the mechanisms by which exposure affects not just mental health outcomes, which has mostly been studied so far, but cognitive, academic, and physical health outcomes as well? And I'm not the triangles here involve associations in the literature between armed conflict and known potential mediators. So armed conflict reduces the access to and quality of safety of education. That's been well documented. Exposure to armed conflict deteriorates outgroup attitudes and behaviors, appears to reduce emotional security, and changes social identity in a way that provokes more potential conflict. But these are all correlational, and we have very, very few studies that actually permit us to study more causal processes in this in areas of armed conflict. What we're particularly interested in is how school-based strategies could affect that whole process to lead to better outcomes. And in conflict-affected countries, school-based strategies could provide access to schools, could affect selection, could affect what kind of schools are in. It could create new schools and improve the quality of schools. We're going to talk about each of those briefly. And the kinds of benefits include increasing accessibility and affordability. This has been the global basic education agenda for the last 10 or 20 years. Reducing stigma of children who have been exposed to conflict, actually, we think is a big deal, and providing support systems as a first line of defense over and above the family. We are especially interested in schools because we think they can be a first line of defense after the first most important line of defense of families. And these are very limited number of studies that are beginning to show impact of interventions to disrupt these forms of transmission. And these are just repetitions of things, but there's some interventions that have shown changes in access to education, in outgroup attitudes, and in social identity. But there's like 6 or 7 of them. That 6 or 7 interventions compared to, and I'm not going to go through all of them, but access to equitable education is posited to be able to do things like increase the opportunity costs to being in conflict and therefore reduce conflict. What a lot of the work does is posit the way interventions can moderate the relationship between exposure and the downstream effects. So these arrows are meant to show moderation effects, not direct effects. And again, I can make this Prezi available to anybody who wants to look at it, to look at the literature. Manuel asked us to think outside of the box, and the only thing I could do is think inside the box. This is one big box, but at least I could get funky, and it's because young people press you. Carly said, "I'm not going to work with you on this unless you learn to use a Prezi." So this is reverse causality. I promise you, I would not have done this on my own. The evidence base on breaking transmission in conflict-affected countries through evidence-based school-based programs is very, very thin. And these represent about 6 studies. And if you compare the 6 studies to many, many other places, most especially in the global north, where evidence from high-income countries is much, much richer, and where social-emotional learning strategies like the kind that Nancy described this morning and we're looking at have been designed to provide universal interventions to improve skills, and they teach certain core principles. I'm not going to go into those in tremendous detail, but I am going to say that the meta-analysis that Nancy mentioned only briefly this morning by Joseph Durlak is based on over 200 studies over the past 20 years involving 200,000 kids in the United States. So that is an evidence base that is so disproportionate compared to the evidence base we have in low and middle income and conflict-affected countries. And it shows these kinds of average effect sizes. So the actual processes in the process model improved by an average of effect size of about 0.57 in those 200 studies. But downstream, the positive social behaviors, the conduct problems, the emotional distress that you'd want to reduce are about a quarter of a standard deviation in effect size across these 200 studies. But a very very well-kept secret in the United States, the largest body of evidence we have about how to mount school-based programs to change academic outcomes are social-emotional learning programs. The effect size is 0.27 on reading and math scores, which is bigger than the effect sizes of many of the academic or cognitive-based interventions. And the most important thing, and this is quite reminiscent of RNR, there's somebody who said it depends on how you do the intervention, and I forget who said that today, but you can code blindly these interventions on how sequenced they are, how much they require active participation by the participants, how focused they are, and how explicit they are in what they want to change, safe. And what you can completely decompose those average effect sizes. They double for programs that are sequence, active, focused, and explicit, and they're 0 for the programs that are not. So it is not just the content of the school-based intervention; it is how it is implemented and the actual nature of the process. And this is tremendously important. And these things take management skill to implement, not just manuals. The evidence is disproportionately weighted in high-income countries. It raises the transportability issues that Francis addressed in parenting programs. And our research group at NYU is beginning to try to think about these things from a very interdisciplinary perspective. And our position in this particular area is that children's learning and development and the prevention of the transmission of violence requires school-based interventions that do 3 things. They go beyond simple access to education. The global education community primarily thinks access is the solution. They go beyond the provision of classroom and school-based resources. Resources are necessary but way not enough. And they go beyond focusing on one single domain, like academic, reading, or social-emotional. They have to be multi-outcome in nature. And that means that we need an evidence base that begins to test interventions like that, and an evidence base that allows us to begin to think about scalability as well. Now, scalability, everything's relative in scalability. I'm going to talk very briefly in my remaining 5 minutes. I think you jipped me on 5 minutes there, okay, sister, but that's in my, no, you probably didn't. And 5 for questions. Okay, great. On work in DRC and Lebanon, and I'm not going to talk about the work in Afghanistan by my colleague Dana Birdie. But with the International Rescue Committee over the last 4 or 5 years, we've been doing a big cluster randomized evaluation of an attempt to infuse social emotional learning principles into primary schools in 3 of the 4 eastern provinces of the Congo. That's the project that Catalina directed until she got wise enough to leave me. This collaboration involves integrating social emotional learning principles, and they are more principles and practices rather than a manualized intervention, although there is a curriculum, and in-service teacher training system that is resuscitating an old indigenous Congolese system of what they call teacher learning circles, where teachers learn by working with each other. So these are the 2 basic elements of the intervention. And across 350 schools serving over 5 years about 500,000 kids, and in a project lasting from 2010 until next year, the schools were organized into administrative clusters of 2 to 6 schools in physical proximity to each other for the purpose of a master teacher going to those schools. And then we randomly assigned clusters of schools to waitlist control, to launching the intervention in 2011, 12, or 13. And I can't imagine being able to talk to anybody about no treatment control schools in the Eastern Congo. It just would feel it's not great for science. It's not plausible in political terms, and so.
But there are always people you can't intervene with.
Pardon?
There's always places you can't stretch the intervention. But randomizing.
It depends on the policy and contractual things. So USAID said 350 schools in this area.
Right.
There isn't, and do a rigorous evaluation, but change those 350 schools on a nickel. So we could do 700 schools. There'd be no money to do that, or you do 350 schools. I'm not going to go through all the details, but we developed a theory of change that looks like those process and social ecological modules I described. But the basic theory of change that is IRC's theory of change is that learning and healing classrooms intervention should change kids' perceptions of their school context first, especially how caring and supportive they believe their schools and teachers are, and how predictable and cooperative the learning environments are. And we developed reliable, culture-valid measures of these adapted from UNICEF's Child-Friendly Schools work. And that these things should in turn improve children's reading and math scores and their mental health and victimization scores. And the results after 1 year of partial treatment are that indeed, the schools in learning, receiving learning and healing classrooms in the first year improved kids' perceptions of how caring and supportive their schools and teachers are. This was the first and second and third IRC goal. IRC, this was the most important criterion. But against what we wanted and certainly predicted, it actually made how predictable and cooperative the learning environment was worse in the treatment schools. Now, on reflection, that's not that surprising because we're asking them to change their practices in a very substantial way. So it both had positive effects on this, but negative effects on this. It had positive effects on reading and on kids' geometry scores in math, but not their addition and subtraction scores. And it had no average effects on mental health and victimization. And we think that's in part because of these offsetting effects of the mediators. And without a mediation, a theory of mediation, a theory of change, then you can't, your complex intervention may improve some of the mediators and make other mediators worse or have no effect, and that's going to affect your downstream outcomes. So Catalina has a paper that I'm sure she's prepared to share with you as soon as we hear from the journal, or if you are willing to give us critical feedback on it. And stay tuned, we're analyzing the data eventually, and we eventually hope to do a limited form of causal mediation analysis on that. The work in Lebanon is at a completely different place in a certain way. We're really focusing there on methodological work, and there's two big responses in Lebanon on how to serve Syrian refugee kids. One response is to create second shift schools where there's public schools in Lebanon, and they just added a second shift to include Syrian kids. But that would not be able to accommodate more than about 30% of the kids in Lebanon. So a second strategy is being developed in the creation of brand new schools, of community-based schools. And we're beginning with descriptive and implementation research there well in advance of trials. We're just trying to learn how these things are being implemented and get it instrumented right. But we're really focusing on the development of research methodologies to work. How do you do rigorous research, not just in low and middle income countries, but in emergencies, in absolute sheer crisis? And that leads to a research agenda that these are my final points. There's a lack of rigorous evidence as to what school-based strategies work for whom and in what context to improve children's development in conflict-affected context. That has to change. To do that, we have to work to build better and novel research methods. That's what we're working on in Lebanon now, the invention of new methods to do this work. It's a counsel of despair to rely exactly on what we're doing right now that works in peaceful or poor conditions to war-related conditions. And those methodologies, we need to use those methodologies to build an evidence base in those kinds of contexts. And the work in Lebanon centers on building this kind of research for descriptive implementation and evaluation research, and then hope to extend that through the Syrian diaspora to work in other countries as well. Now you see that in the Prezi has all been a classroom. Okay, so I've been in the box the whole time, and the blackboard and the map and the reading and all that kind of stuff. But this is to remind you that we believe that these school-based interventions have to be complemented by community, family, and media level interventions. We are not preaching schools will solve everything. We are preaching that schools are an indispensable ingredient. Thanks very much.